everyone, what's up? My name is Vaughn and welcome back to my channel. In today's video, I know you clicked this video because you've read the title of this vlog. We will be talking about common mistakes and errors during your OSCE examination.
Hold up.
Okay guys, so I thought that this video will be very helpful in making sure that when you take the OSCE, you can avoid these common errors and mistakes. This is a compilation by the Northampton University. So this is a credible list of errors and mistakes during the OSCE examination. Okay, so we will divide the discussion into 6 components. One will be the common errors and mistakes for all stations. Second, we will discuss specifically common errors and mistakes during assessment, planning, implementation, evaluation, and the clinical skills. Right, so just a disclaimer, I am making this video not to frighten anyone or you guys who are gonna be taking the OSCE, not also to intimidate you, but to strengthen your core in learning the skills and the areas on your OSCE examination. Alright, so let's begin. The one most common error or mistake taken in all stations is lack of communication. That includes the verbal, non-verbal, or even not listening to the patient. You have to listen to the cue or the keywords given to you as an instruction by your examiner. You have to listen to the patient's complaint and you have to listen to the instruction. Now, you also have to verbalize and tell as clear as you can the things that you need to do while you are doing the OSCE. Next will be not reading the scenario or instructions accurately and properly. So that might mislead you to do something that is not asked for you to do during your examination. So always remember to read the scenarios accurately and properly. Next on my list will be not completing the paperwork or assessment requested within the 15 minutes. So always remember you are timed during the OSCE and you have to be self-conscious as well. There is a clock in front of you or a timer in front of you. So always remember, if you need to do a task, always remember to please be on time or finish the skills before 15 minutes or the allotted time schedule. Next common errors, touching the patient before conducting hand hygiene techniques. So always remember your hand washing first for all patient contact. Next on the list, not knowing or identifying if patients has allergy or not checking the allergy band written on the chart or indicated on the wristband of your patient. So please remember that this is really essential for you to be able to carry out the skills, especially during assessments. Another common mistake is not checking patient identity. Always check the identity of the patient by asking the patient, checking the wristband, or checking the identity labels on the chart. So always remember to check the identity of your patient because this is one crucial step for your assessment as well, and in all other procedures in different stations during the OSCE. Another mistake, not obtaining consent from the patient. So always remember to obtain consent from the patient. If there is a live actor, ask a consent from the live actor, or if there is an examiner that pretends to be the patient, always ask for a consent. No matter what procedure you are doing, before you do the procedure or the skills, always ask consent from the patient, because in real life you always have to do that one in building trust between you and your patient. Another common error for all stations, not ensuring safety. So that's really the first thing you should say, that ensuring that the scene or the environment is safe. in all skills and even the assessment area. You have to verbalize that one clearly, that the environment or the scene is safe. The last but not the least, among the common mistakes and errors in all areas of the OSCE is not completing the station within the time frame. So no matter what, if it's assessment, planning, implementation, evaluation, or the set of skills, you have to complete this task within the set time frame, or else you will have a failing score or a deducted mark. So please bear that in mind. So those are the general common errors and mistakes in all stations. But let's go to the specific areas. Let's start with assessment. So Northampton has identified two common errors and mistakes during the OSCE. One is not completing the vital signs accurately, and number two is not completing the documentation accurately. So your documentation, especially your observation and the new score, is really essential for you to pass the OSCE. So I've known some friends and some colleagues who failed to document and complete the observation and to interpret the new score. They failed the OSCE examination. So please do not neglect the observation bit of the OSCE during the assessment, especially the interpretation of the new score. Now, Northampton University has cited some common mistakes and errors on the planning stage. Let me read to you one by one. Number one, evaluation date not within the prescribed time frame. We are talking about the planning, okay? In the planning stage, you have to identify the evaluation date. So failure on that leads to OSCE failure. Number two, incomplete documentation. May it be you haven't finished it within the time frame. Please complete the documentation. Number three, not considering elements of self-care for the patient. Always remember, the UK and the Nursing and Midwifery Council always advocate patients' independence and self-care. So please include elements of self-care for the patient on your planning. Another one is illegible documentation. Please make your penmanship or handwriting readable and legible. One common error as well on this writing stage during the planning stage is using abbreviation which is not recognized. So please avoid using unrecognized or non-registered abbreviation, especially medical term abbreviation. Please, if you can spell it out, because this is a test, this is an exam. So please do not use unnecessary abbreviation while writing your planning on the planning stage of the exam. And the last but not the least on the planning stage, errors not dealt with correctly. So if you have some errors, please erase it properly, or do not just tamper anything that was written. Please erase that one. If you've committed an error, erase it properly and then make it sure that it is still readable. Bear in mind that you are on a writing skill. So the main important thing here is to make it readable, legible, and comprehensive. Now let's go to the implementation phase. So the most common errors and mistakes. Number one, not checking the expiry date of the drugs. During the implementation phase, usually it is a medication administration skill. So make sure that you've checked the expiry dates of the drugs. Number two, not reading the medication chart properly. Maybe because the medication is due to start tomorrow or later. So please read the prescription properly. Next would be overdose or underdose the patient. Now, please be careful on your drug calculation. They usually use tablet form. Make sure that during your drug computation or calculation, do not overdose or underdose the patient, because this is important for patient safety. And the last but not the least on the implementation phase is signing for the medication prior to administration. Do not sign the medication chart if you have not yet given the medication. Do not pre-sign it. or do not forget to sign if you've given the medication, because that is really important during medication administration. So those are the common lists of errors and mistakes on the implementation phase of your OSCE. Alright, we're almost done. Let's go now to evaluation. What are the common errors and mistakes on the evaluation stage? Number 1, reason for admission or date of admission. These dates and information are essential for the evaluation phase. Do not omit the reason for admission or the date of admission. So please familiarize in the NMC link, NMC website. There is a sample of the evaluation form or the planning form. Please familiarize yourself on each and every sections of the form for you not to omit or forget anything in the evaluation form or any form of the OSCE exam. Again, another form of mistake and errors in the evaluation phase, illegible documentation. Please just make sure you write it very clearly, as I've said a while ago. Abbreviation, still the abbreviation, using inappropriate abbreviation or abbreviation not recognized. And the last but not the least is errors, the same. Errors not dealt with correctly. So those tips and errors committed on the planning are almost the same errors committed on the evaluation, because those two are the two writing components of the OSCE. We are now down to the last skill or the last phase of the OSCE. During the OSCE, you are asked to perform 2 skills. So these are the common errors and mistakes during the skills performance. Number 1, contamination of the sterile field. If you contaminate the sterile field without acknowledging it or making sure that it has been rectified, that's gonna be a mess. Number 2, chest compression. That was before with the BLS. Chest compression are not deep enough or too fast or too slow. So this is in the BLS section. Number 3, chest compressions are not timely. Again, this is with the BLS. Number 4, discarding ampule prior to the administration of injection. So if you are asked to do subcutaneous injection or intramuscular injection, do not discard the ampule prior to the administration of injection. Number 5, incorrect documentation of the skills done. And number 6 is breaching sterile field. So it doesn't mean that you breach the sterile field, you're gonna fail. If you breach the sterile field, well, of course, what will you do in the real scenario? Of course, you acknowledge that you breached the sterile field, so acknowledge it and say, oh, I breached the sterile field, I will have to make another sterile field for me to be able to carry out this procedure properly. It's just a matter of not hiding the mistakes you've committed, but correcting it so that you are not compromising patient safety and nurse safety. So guys, I hope you've learned something from the lists of common mistakes and errors during the OSCE examination. Now, as I've said, just to go back to my disclaimer a while ago, these points are not to intimidate you or frighten you during your examination, but to give you awareness where to focus and improve during the OSCE examination, and of course during your preparation for your incoming OSCE. Alright guys, so thank you for watching the video. If you like this video, please give me a thumbs up. Drop some comments down below if I've missed anything or you wanted to add something. If you have taken the OSCE before, you can help those who are gonna be taking the OSCE sooner, so please write them some advices or some comments or some feedback. We are just open on the discussion, and share this to your friends. So once again, thank you for watching the video. See you on the next videos and adventure.